Your heart has 4 pumping chambers, and you want those chambers to pump, not quiver. In atrial fibrillation, the 2 top chambers quiver. Hi, I'm Dr. Nancy Keating. Here's the heart, pumping blood around the body. The 2 top chambers of the heart collect blood that is coming in from the lungs and the rest of the body. These top chambers are called the atria. The atria pump blood down into the 2 bottom chambers, the ventricles. The bigger and more powerful ventricles pump blood to the entire body. For the heart to perform at its best, all 4 chambers have to pump forcefully and at the right time. That doesn't happen in the very common condition called atrial fibrillation. In the healthy heart, the chambers are all coordinated. This is what it looks like in slow motion. First, the atria pump, then the ventricles, then the atria, then the ventricles. Here it is again at the normal rate, about 60 to 80 times a minute. This is what keeps your circulation constantly moving. In atrial fibrillation, the atria don't pump, they just quiver. Here is what it looks like. From the outside, the atria look just like a bag of wriggling worms. They don't do a good job of pumping. Since the heart doesn't pump as effectively when 2 of its 4 chambers aren't working properly, atrial fibrillation can sometimes lead to heart failure, although it usually doesn't. Another complication is that some blood just sits in the quivering atria and doesn't move down into the ventricles. When blood isn't moving, it tends to clot. Clots that form in the quivering atria can then travel through the circulation until they get stuck in a blood vessel. If they get stuck in an artery in the brain, they can cause a stroke. In fact, atrial fibrillation is one of the most common causes of a stroke. There are medicines and other treatments to correct atrial fibrillation. In some people, atrial fibrillation can't be corrected. For these people, it's important to take a blood thinner to prevent clots from forming. From Harvard, I wish you good health.